Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Jill Sutton, a pediatrician at Terrebonne General Health System. We'll be discussing Baby Safety Month. Welcome to the show, Dr. Sutton.
Thanks for having me.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Okay, I'm Dr. Jill Sutton. I was born in Houma, and I've been a pediatrician at Terrebonne General Pediatric Care for the past 6 years.
Okay, 6 years has flown by, huh?
It's really gone fast.
All right, well, Baby Safety Month is coming up, or now. Can you tell us more about when it is and why is it important?
Baby Safety Month is every year in September. It's important because it aims to educate parents and caregivers, retailers about different ways to keep babies and toddlers safe.
What are some tips to keep your baby safe at home?
So there are several things that you can do to baby-proof your house. These are things like putting locks on cabinet doors, drawers to make it more difficult for babies and toddlers to get into things. You can also make sure to pick up any guns, knives, weapons. Those things need to be put far out of reach, away from any little hands. And then same with medications, cleaning products. Those things also should be put far out of reach and locked away so that way kids can't get into them and accidentally ingest them. And that could cause some serious health issues, of course. And then some other things, you want to make sure that garbage cans are also, covered, put out of reach as well, just so that way they can't get into the garbage can. They can get all kinds of things out of the garbage, like, medicines, trash. That is gross, but also might look yummy to a little baby.
Exactly. I know those little pods, the laundry detergent
Tide pods,
pods.
that's a big one, yeah. Tide pods, the dishwasher pods, medicines, and even gummy vitamins. All that stuff looks like candy to a kid, and it could be harmful if they eat a lot of it.
Okay, and what about some safe sleep tips?
Safe sleep is very important. So safe sleep are things that can prevent suffocation or sudden infant death syndrome in babies. So those are going to be things like putting your baby on their back to sleep at night, especially for the first 6 months or until they can roll over from in both directions on their own. Keeping other things out of their bed area. So every baby should be in their own space, not in the bed with the parents or any caregivers, with no fluffy blankets, no pillows, no stuffed animals in the bed with them, and no crib bumpers around them as well. Nothing in there that they could potentially roll into that could block their nose and mouth and keep them from breathing.
Okay, and I know there's babies play with toys, so
Yes.
some safety tips for toys.
Yeah, so for toys, especially for kids under 3 years of age, you want to make sure that there's no small parts that they could put into their mouths, potentially choke on. Those are going to be especially things with removable magnets or button batteries that have easy access. So anything with a button battery should have a screwed-on battery compartment to prevent choking and swallowing of those little parts.
Okay, very important. All right, so car seat safety is important too.
Yes.
Does Terrebonne General offer a car seat program for parents?
Yes, Terrebonne General offers some free car seat safety checks. Those are every Wednesday at the Women's Center from 10 a.m. to 12 noon.
Okay, and what are some hazards in the kitchen? I know you mentioned some, but other hazards.
Yeah, so hazards, those are going to be things like heat. So make sure that microwaves, especially if you have a microwave that's lower in the countertop, isn't easy for a kid to open and grab a hot, something hot out of there. Make sure that the oven or the stove is protected as well, and same with oven knobs. They make oven knob protectors, that way the kids can't easily turn the oven on, turn the stove on, because all those things can cause burns, cause fires, and so all of that should be out of reach and protected. And then same with the Tide pods and the dishwasher detergent pods. All of the cleaning products should all be out of the way as well.
Okay, and why is it important for parents to bring their children for Wellbaby visits?
So Wellbaby visits happen at specified intervals all throughout your child's life, really. But we do a whole bunch of things at the well visits. We're making sure that kids are up to date on their vaccines. We're making sure that they're growing appropriately. We're making sure that they're hitting all of their developmental milestones the way that they should. It's a good opportunity for parents to be able to ask us any questions that they want to ask us, and just make sure that they're overall eating well, growing well, and all that.
Thriving. And so how often are wellness visits done?
So at birth, they're very often. So they're about every right after you get out of the hospital. There's one at 2 weeks, 1 month, 2 months, 4 months, 6 months. And they get more spaced out as your child grows older. And then once they're 3 and up, it's every year.
Okay. So what are the main takeaways you would like people to know about baby safety?
That baby safety is something that should be taken very seriously. There are lots of big accidents that can happen, lots of injuries, and ingestions are a big one too whenever your baby accidentally eats something. So making sure that everything is kept up and out of reach that a baby could potentially put in their mouths is very important.
Okay. All right. Well, are you accepting new patients, and how do patients get in touch with you?
We are accepting new patients. Patients can call Terrebonne General Pediatric Care at 985-850-6244 to schedule an appointment.
All right. Well, thank you so much for being with us today and sharing that helpful information.
Thanks for having me.
For more information on baby safety and Terrebonne General Pediatric Care, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.